I might make a start just so I'm not keeping everyone around for too long. So good morning everyone and welcome to this Heart Foundation Walking webinar. Thank you for joining me. I'd like to introduce myself as the webinar facilitator today. My name's Sienna Gamble and I'm a walking program officer at the Heart Foundation. Today we'll be discussing Heart Foundation walking in the time of COVID-19 with time for questions throughout and at the end. So please keep in mind these slides will be emailed to all attendees shortly after the presentation, and the webinar recording will be uploaded to the Heart Foundation website. There we are, next slide, that worked. I'd like to start by acknowledging that the Heart Foundation is spread across many of our traditional lands. We pay respect to all traditional owners of these lands and those who are under custodial law are charged with nurturing and protecting country. We pay respect to elders past, present and emerging. By attending this webinar today, we will learn the importance of staying active during these times, learn new Heart Foundation walking practices that can help you do so safely, learn about the infamous COVID safety plans, hear examples of how people are sharing streets to stay safe and keep physically distanced while walking, and also hear example of how LCs and walk organisers such as yourself are keeping their walkers really engaged during this time. So the aim is to make this webinar as interactive as possible. So if you have any questions, please just go ahead and type it into the Q&A function that appears at the bottom of your screen. The question and answer feature will allow the attendees to ask questions during the webinar, and the hosts such as myself, Emily or Kristen, to answer these questions. So the Q&A is at the controls in the bottom of your screen. So you just need to type your message and press send to send it. As an attendee, you can also like or comment on any other attendees' questions. So I'm very keen to hear your questions. And following the presentation, I'll dedicate the rest of the webinar to answering your questions. So let's make a start. So it's been apparent that physical distancing is going to be with us for a while. So what does this mean for walking and more specifically Heart Foundation walking? Well, all states may walk in groups of up to 20 people. However, you must continue to practice physical distancing from anyone who is not a member of your immediate household. While exercise is one of the reasons you may leave your home, and yes, you may drive to your place of exercise, use your judgment and stay close to home if possible and seek out spaces to walk where it's easy to keep that 1.5 meters distance from other walkers. We'll speak more about that later. So first I want to start around the importance of staying active. COVID-19 has radically changed our travel and exercise habits in just a matter of months. A Heart Foundation survey of almost 300 Australians in April illustrated how COVID-19 has affected us all differently, with 30% of people walking more than they usually would. However, 25% are walking less, prompting the Heart Foundation to urge everyone to keep moving for the sake of their heart health. Staying active is crucial during this pandemic, and we shouldn't underestimate the many benefits of walking. Regular exercise is one of the best choices to reduce your risk of heart disease, lower stress, and build a healthier body. While it's heartening to see close to 1/3 of Australians are walking more, it's equally concerning that many say they're walking less. Indeed, many medical experts are stressing the importance of exercise, particularly walking, in the fight against COVID-19. However, we're all facing a barrage of information, and so it's not surprising many people are feeling slightly confused. So Victoria Walks, which is an independent health promotion charity that advocates for safe, accessible and connected environments, recently asked their Facebook followers how they were handling their new reality and whether they'd managed to take a quiet walk over the weekend. The responses that I've listed on this slide here show many walkers are continuing to find strength and solace in walking, especially in troubled times. So you've got people like Lisa here who went for a walk on both Saturday and Sunday, went early in the morning and it took her mind off everything and felt like she could face anything that comes her way. We've also got Kath and Deb here who walked around their local environment and found solace in that. It's clear that many people are adapting, seeking out quiet times or places to walk and keeping the recommended 1.5 meters distance from those who pass. So as Heart Foundation, as COVID restrictions continue to ease across the country in accordance with government guidelines, Heart Foundation walking groups can recommence from Saturday the 20th of June, provided that your walking group meet the following criteria. 1, that your state and territory is in at least step 2 of easing restrictions. And 2, that your walking group has a maximum of 20 walkers if in step 2, or maximum of 100 if in step 3. Please note though, restrictions are changing day by day. For example, Queensland, where I live, recently updated their roadmap and moved forward the date of step 2. So please keep up to date with your state's updates. So as of yesterday, as you can see, I went through all the states looking at the group limits. And what I found was that in Queensland, New South Wales, Victoria and South Australia all have a 20-person limit still on their walking groups. Tasmania has an 80-person limit, but only with outdoor venue. So if it's a shopping centre, this wouldn't apply. Western Australia has a 100-person limit for groups. So you can go a bit more liberal with your walking groups over there. Northern Territory has no limits on gatherings, but still maintain physical distancing as preventative measure. And ACT has a 20-person limit, but as of Friday, it will be increased to a 100-person limit. So keep in mind, that's as of today. I can't say what's going to happen tomorrow. So while some restrictions are easing, it's important for everybody, including walkers, to keep playing their part to stop the spread of COVID-19. So remember, everyone participating in a Heart Foundation walk must continue social distancing. That's keeping 1.5 meters distance from others, including social interactions before and after your walk. 2, stay home if unwell. So if you have a fever, cough, runny nose or sore throat, just use your common sense. If you're feeling sick, don't come in for the walk. Seek testing for any COVID symptoms and report a positive test result to the Heart Foundation walking team as soon as possible. Also, practice good hand hygiene and cover coughs and sneezes. So as I briefly mentioned, any social interactions organised before or after each walk must be in strict compliance with social distancing rules and in line with the advice of your respective state or territory. So in addition to these requirements, the Heart Foundation also encourages walkers to 1, get the annual flu vaccination, 2, bring your own hand sanitizer to the walk, 3, talk to your doctor about whether rejoining the walks at this stage is appropriate for you, particularly if you're in a vulnerable population. This includes older walkers and those with chronic health conditions, pardon me. And finally, download the COVID Safe app and use it at all times. So I want to reiterate, these are not requirements, but rather guidance from us, and we encourage all groups to take it on board. So here are some essential practices to ensure safe group walking. As a walk organizer, please take an attendance log at each walk to ensure that all walkers are registered participants of the program, and ensure your contact details are up to date on your online profile. So these steps are not just for our sake or even to run the walker recognition scheme, but important for the safety and contact tracing purposes. So maintaining accurate attendance records are a government requirement as part of the COVID safety plans, as I'll explain soon. So you can complete attendance manually or via your online profile. As you can see on the right here, I've just taken a screenshot of the dashboard. And you can view your online profile by visiting www.walking.heartfoundation.org.au and clicking the login at the top right of your screen. So along the banner at the top, it's the one on the very right. Now, similarly, there are some essential practices for local coordinators as well. As local coordinators, please reiterate that all walkers must be registered and attendance logs submitted on time as part of the compliance to return to walking. And also ensure your contact details are up to date on your online profile so that we have a way of contacting you in any scenario. So you can view your online profile the same way by logging into walking.heartfoundation.org.au and clicking the login at the top right of your screen. Perfect. So it's been it's a little bit of information to take in there. So I want to quickly check out the questions coming in through the Q&A function, see if I need to explain anything further there. We're all good. Fantastic. Just had the thumbs up from Emily and Kristen here. So I might go next to the COVID safety plans. Now this might be a new area for a lot of people, as it was to me, but I'll do my best to walk you through it as easily as possible. Had quite a lot of guidance from Kristen here. She's been a blessing. And I've broken it down state by state. So to allow restrictions to be safely eased, having a COVID safety plan is mandatory for certain organisations, such as Heart Foundation Walking, that were restricted and now reopening or transitioning back to regular modes of business. The basis of all Heart Foundation Walking COVID safety plans is as follows. It goes over 3 slides, so bear with me, it's all the one plan. Firstly, everyone participating in a Heart Foundation walk must continue social distancing, stay home if unwell, seek testing for any COVID-19 symptoms and report a positive test result to the Heart Foundation walking team as soon as possible, practice good hand hygiene and cover coughs and sneezes, and have their own water bottles, towels, and personal items which will not be shared. 2. Heart Foundation also encourages walkers to download the COVID Safe app and use it at all times, get the annual flu vaccination, bring your own hand sanitizer to each walk and use pre, during, and post the walk, and talk to their doctor about rejoining the walks at this stage as appropriate for them, particularly if participants are vulnerable. This includes older walkers and those with chronic health conditions. 3. Walk organisers must take an attendance log after each walk for safety and contact tracing purposes. 2. Ensure all walkers are registered participants of the program. And 3. Limit the number of participants per group if necessary to adhere to restrictions. So please check on any capacity restrictions in your own state or territory. I've listed them before earlier in the slides, but as I said, that was today, not sure about tomorrow. So please note as well, if you conduct your walks in a shopping centre, i.e. indoors, you must follow the Heart Foundation COVID safety plan as described, as well as any direction received from the shopping centres, as they must ensure the implementation of any relevant legislation over and above what we might be required to do. So obviously, indoor venues, there's some considerations that isn't listed here. Perfect, so let's go through state by state. So this is our national COVID plan, but obviously there's different obligations. Please pay attention to just your respective state, as it can get a bit confusing if we're listening to different ones at different times. So South Australia. South Australia requires the Heart Foundation has a specific government prescribed COVID safety plan. The Heart Foundation has submitted a COVID safety plan on behalf of all South Australian walking groups. So this is after talking to the South Australian government, we've come to this conclusion. So if you are a walk organiser and you are requested to provide information to anyone about your COVID safety plan, please refer to the correspondence received from Heart Foundation Walking. So this correspondence includes our expectations and recommendations on how to safely participate in your walks. And this is our COVID safety plan. So the 3 blue slides that I previously mentioned. You do not need to complete or submit any individual plans. So you can rest easy, South Australia. Next, New South Wales. New South Wales requires that the Heart Foundation has a general COVID safety plan, but does not require a separate plan to be submitted for each walking group. If you're a walk organiser and you're requested to provide information to anyone about your COVID safety plan, please refer to the correspondence received by Heart Foundation Walking. This correspondence includes our expectations and recommendations on how to safely participate in your walks, and this is the COVID safety plan. You do not need to complete or submit individual plans. Lucky New South Wales. Moving on. ACT. So whilst it's not required, it is recommended that the Heart Foundation Walking develop a COVID safe environmental plan consistent with ACT government guidelines. So the Heart Foundation has created a template COVID safety plan. If you're a walk organiser and you're requested to provide information, please respond to the correspondence received by Heart Foundation Walking. As previously mentioned, this includes our expectations and recommendations and is the National COVID Safety Plan. So you do not need to complete or submit individual plans. And as I mentioned, your restrictions are actually, I think they call it step 2.2, where you're going up to the 80 or 100 walkers soon. So just pay attention to what's happening in ACT. Victoria. It is not a requirement for Heart Foundation Walking to complete any sort of government prescribed template in Victoria. However, on the off chance that you're a walk organiser and you're requested to provide information, please refer to the correspondence received by Heart Foundation Walking. This correspondence includes our expectations and recommendations on how to safely participate in your walks, and this is the COVID safety plan. You do not need to complete or submit individual plans. Tasmania. So in Tasmania as well, it is not a requirement for Heart Foundation Walking to complete any sort of government prescribed template. However, if you're a walk organiser and you're requested to provide information to anyone about your COVID safety plan, please refer to the correspondence received by Heart Foundation Walking. That is the national plan, and it includes our expectations and recommendations on how to safely participate in walks. You do not need to complete or submit individual plans. Queensland. So Queensland requires that Heart Foundation Walking has a general COVID safety plan. And so the Heart Foundation has created a template COVID safety plan. If you're a walk organiser and you're requested to provide information about your COVID safety plan to anyone, please refer to the correspondence received by Heart Foundation Walking. And this correspondence includes our expectations and recommendations on how to safely participate in your walks, and this is our COVID safety plan. So I might just quickly check in with Kristen here. In this instance, have we submitted one for the whole state or for Queensland? But what you guys need to worry about is that you do not need to complete or submit individual plans.
I'm not sure if you can hear me or you're going to get some feedback.
I'm going to use yours to speak through mine.
I'm not sure if you can hear me, but for Queensland, we've done the same thing as in most other states, in that we've got a general Heart Foundation walking plan that we've put together and have submitted. So if you're a walk organiser in Queensland, you won't need to do one yourself or submit it anywhere. And as Sienna has mentioned, if you're asked to provide any evidence of a plan, please again just refer to the information that Heart Foundation Walking has sent you over email. It's all of the dot points that Sienna has gone through, which make up the plan, for want of a better word. So just making sure that we're staying safe whilst walking, and all of the things that we're encouraging your walkers to do, that makes up our plan. But if you have any questions, just get in touch and we can help you further.
Fantastic, thank you so much. Okay, here's where it gets a little different. So listen in Western Australia. In Western Australia, each walking group is required to submit a plan prior to relaunching. If you're a walk organiser in Western Australia, you are required to complete a COVID safety plan on behalf of your group, as has been communicated by email. So we have provided you with dot points that form the basis of a plan and instructions regarding most of the fields you will need to fill in. So once you have submitted the plan on your group's behalf, please email Heart Foundation Walking to confirm that you have completed your plan. All WA walk organisers and local coordinators have been emailed a partially completed COVID safety plan by the Heart Foundation Walking team. And so this plan needs to be completed in accordance with the email's instructions, and most importantly, brought to each walk by the group's walk organiser. In case someone asks you to produce the COVID safety plan, or if you have one, you need to have it on you. Now, I guess this could be held on your mobile device if you don't want to carry around sheets of paper. In that case, just screenshot the whole document. Okay, lastly, we've got the Northern Territory. Now, similarly to Western Australia, in the Northern Territory, each walking group is required to submit a plan prior to relaunching. So if you're a walk organiser in the Northern Territory, you're required to complete a COVID safety plan on behalf of your group, as we've communicated. So we have provided you with dot points that form the basis of your plan. Once you have submitted the plan on the group's behalf, please email Heart Foundation Walking to confirm that the plan has been completed. It's also a government requirement in the Northern Territory that all groups submit your COVID safety plan online Now, I've done some digging myself and found the link that you'll need to go to complete the online plan, which is here. Now, as I said, these slides will be available to you immediately after the webinar, and so you can just use this link to go straight on, or just email us and I can send the link straight through. Okay, once again, a lot of information. I'm going to open the webinar back up to questions. So let's have a look at the questions. So I see Emily and Kristen have been answering quite a few of them, mostly about the 20 walkers or so. And there are quite a few questions I'm going to get to. But we've got one from Elizabeth Crane. I'm here in Queensland and I'm interested which industry plan or plan you are basing this on. As a local council, we will consider this as meeting the return to play and local government approval and requirements are necessary. This would include a local plan. Now, Kristen, do you want to take over here?
Yeah, sure.
Do you want to pop your head around as well? Maybe. I'm still going to answer that live.
Can't get too close. So in Queensland, we've looked at the return to play and all of the requirements. We don't actually technically fit under any of the categories that they've deemed require a local plan. So what we've done is we've put the plan together anyway to comply with workplace health and safety laws, just to be on the safe side. So yeah, to answer your question, Elizabeth, we don't necessarily fit within the return to play that requires the local government approval. So yeah, but if you have any other questions about that, please let us know. But otherwise, our general COVID safety plan will form the basis of our local plan for Queensland. I hope that answers your question.
Perfect, thank you, Kristen. Maria, I'll be answering your question very soon in the webinar. But Lynn, I can see here that you had trouble joining. Please revisit info on New South Wales. No problem. So New South Wales requires that the Heart Foundation has a general COVID safety plan that does not require that a separate plan must be submitted for each group. If you're a walk organizer and are requested information about your plan, please just refer to the correspondence that's been sent out by the Heart Foundation, which is the National COVID Safety Plan. You do not need to complete or submit individual plans in New South Wales. There we are. Fantastic. All right, that's all the questions for now. Don't worry, there'll be time later. Let's keep it moving though. So we've discussed Heart Foundation walking practices and COVID safety plans, but I want to address some of the questions that I've received from people since this webinar invitation got sent out. So one of the most common questions, I'm a walk organizer and don't feel comfortable starting up my walking group just yet. So as a volunteer walk organizer, if you don't feel comfortable to support the return of the walking group at this stage, you may wish to consider finding an alternative walk organizer or continue to keep the group on pause for now. You do not need to restart on the 20th if you don't want to. However, please just let your group know. The same goes for local coordinators who don't feel comfortable with recommencing. As a local coordinator, it is your choice to recommence your walking groups, and whatever decision you take, you'll have the full support of Heart Foundation. Now, another question that's come through quite a bit, what happens in someone if our walking group tests positive for COVID-19? Now, first and foremost, please just follow your state government's instructions. On top of that, we encourage walkers to seek testing for any COVID symptoms and report a positive test result to the Heart Foundation walking team as soon as possible. So that would either be calling 13 11 12, which is our helpline, or emailing walking@heartfoundation.org.au to complete an incident report form. And this is just one of the reasons why it's so important to record walker attendance and make sure all your walkers are registered for instances such as these. Because similar to the COVID Safe app, this provides a tracing mechanism to alert people that might have been in possible contact. Another commonly asked question has been, my walking group walks indoors, what other considerations are there? So for walkers walking indoors, such as shopping centres, added hygiene precautions should be followed and ensure social distancing is practiced at all times. So please refer to specific information for your state and territory regarding indoor-outdoor gatherings, which I've listed here on the slide. But if you're a local coordinator for an indoor group, it'd be a really good idea to reach out to your walk organizer to confirm plans, and vice versa for walk organizers of indoor groups. Just make sure you're both on the same page about what is happening there. Another question. I'm a walk organizer with a walking group that has more than 20 walkers. What do I do? Now, this has been the most requested question by far, and I see why. So although some states have opened up to more than 20, the majority of states are still at 20 walkers. So with a maximum of 20 people being allowed to meet and participate in outdoor activities, this will need to be adhered to. A solution would be to split into separate groups and to stagger the start time of each group. For example, should 34 walkers turn up to a walk, split into 2 groups, and then maybe one group starts 5 minutes or 10 minutes before the second group. So if you choose to do this, both groups must be led by a walk organizer. So if you currently only have one walk organizer in the group, another person will need to register and do their training. If you have a secondary walk organizer already, then that's fine, just one in each group. So please contact walking@heartfoundation.org.au if you would like more information on how to become a walk organizer or register a secondary walk organizer. We are here to help. So these are just some of the questions that have already come up, but please keep them coming in so we can address them all at the end. So onto something a little different. It's also timely that we acknowledge that the number of people out walking and cycling has really changed our streetscapes. The coronavirus pandemic has dramatically shifted our lives and the ways we move about our cities. So despite tight restrictions on non-essential work and outings and on social gatherings in every state and territory, exercise is consistently listed as an essential activity. So as a result, we've seen increases in the number of people walking and cycling. So physical activities such as walking are perfectly compatible with physical distancing, but only with the right infrastructure. So when footpaths aren't wide and getting crowded, it's tough to keep decent amount of space between you and other people. So some cities are experimenting with closing streets to cars to allow more room for pedestrians, and we've seen a bit of this in Australia so far as well. So just some examples across the world with a rapid rollout of walk-friendly infrastructure has been Paris rolling out 650 kilometres of emergency bike lanes, Milan announcing 35 kilometres of streets transformed for walking and cycling, Oakland in the US has dedicated 10% of the city streets to walking and cycling. A bit closer to home, New Zealand has announced significant funding to help councils create people-friendly spaces. And here in Australia, Melbourne has announced 40 kilometres of new bike lanes and wider footpaths, and Sydney 10 kilometres of new bike lanes. So even with these new bike lanes, you may think it might just be addressing extra cycling space, but that actually brings bikes off the footpaths and creates wider footpaths, so better for us walkers as well. So just for your information, more than 100 Australian health and transport experts have signed an open letter calling on governments to enact urgent measures to support safe walking. And you can read more about the calls for healthy infrastructure online, also at the link I provided here. And if you're interested in what your local council is doing, contact them and see. And if you're from a council, message in, let us know. We're very interested in this space here. However, in the meantime, I do want to highlight some tips and guidance on how to share streets to stay safe and keep physical distance while walking. So, firstly, pick your time and place. If you can, try and get off the beaten track and walk grassy areas in local parks or sports ovals rather than choosing crowded trails or footpaths. Try to choose parks and paths, that's a tongue twister, that are relatively quiet. So now's the perfect time to experience the joy of discovering new streets and green spaces on foot. You're guaranteed to notice things at walking pace you've never previously noticed. So your neighborhood is just there, go out and explore it. You can find new routes by Googling walks nearby on your phone or computer. Council websites and community websites are also really great resources. So I recommend also thinking about timing of your walks. So early in the morning, midday, or later in the afternoon, the paths are less busy, especially in densely populated areas. Number 2, bring your own supplies. So we recommend taking your own water bottle rather than using public water fountains, and washing your hands thoroughly with soap for at least 20 seconds if you use any public toilets along your walk. If available, please bring your own hand sanitizer to each walk. Number 3, be predictable on shared paths. So while it's always important to be predictable and considerate to others on shared paths, with even more people out and exercising, it's especially important. So bike riders must legally keep left and give way to walkers on shared paths, while walkers can walk together. However, we might need to be a bit more give and take at the moment, and walk on the left if possible. If a bike rider rings a bell, hopefully from a distance so it doesn't startle you too much, give them a little wave and let them know you've heard. You could even trial a system where you say bike back or bike front if it's coming from the front, so that other walkers in your group know exactly what's going on. At the end of the day, just try and be predictable rather than making sudden movements. And if you've got prams or dogs or children, just try and keep them close by. Number 4, check your state's park alerts. So if you walk in a park or nature reserve, check your state's alerts for the latest information on access, closures, and conditions if that applies to you. For instance, I went through and found all these links for the different state alerts and noticed that in quite a few places, certain parks might be closed in places where they know people can't socially distance. So I've linked the list to each state sites on this slide. Once again, I'll be sending these slides out so you can just take it directly from here if you want to check for yourself. Finally, be considerate and friendly. So with an emergency situation like COVID-19, it's an opportunity to show others that you care, including how we behave when we exercise and socially get out there and walk with our friends. So it's inevitable you're going to be crossing the path with different people while people are spending quality time out in the fresh air. So when you see other people out there, just wave and smile and make sure you keep that 1.5 meters apart. It's really important to look out for others, especially your own walkers who may need extra consideration. So please be aware of any older walkers in your group or people with disabilities who might be unsteady on their feet. Give them room and get off the path if necessary so they aren't forced onto the road or uneven surfaces. We're all in this together, and it requires that we share the spaces that we have. Be kind, be patient, and let's keep friendly on our walks. So yeah, if you do go for a walk to get some essential exercise, look out for others, keep your distance, and be friendly. Will make it more enjoyable for you as well as everyone else around us. So now that I've listed some ideas, I've got some practical ideas for walk organisers to ensure that this physical distancing takes place. So if your usual route or routine may prevent physical distancing, here's some tips that you can implement the previous ideas. So one idea is to mix up your route by try walking every street in the suburb. So I had some family members that recently did this, and they've noticed lots of new treasures in the suburb that they didn't really know about before, such as a community garden and little library set up in front of someone's house. So it could be a fun activity for your walking group. Try changing an 8 AM walk to a 9 AM walk to avoid work crowds, and similarly 5 PM to 4 PM. Now, these are just numbers I've pulled out of the hat, that times I pulled out of the hat. You can make up your mind the exact numbers, but what I'm trying to stress here is that if you're walking at a time where the working crowd might also be walking, then maybe just switch that up a little bit. You could also try sharing a virtual coffee after the walk instead of gathering together. So coffee or tea, whatever your preference, I don't mind. But you could try walking together and then heading home and getting on the phone and sharing a coffee and a quick chat that way, rather than having to try and physical distance over that coffee because it's a little hard. You can also think about going for different or themed walks. So you could see, go for a wildlife walk and see if you can see any birds perhaps on the walk, or architecture. If there's any cool architecture around you, or statues, or gardens, or food, could be a nice idea. Go for a different coffee along all the way and have well, actually, that's not a good Heart Foundation guidance, is it? You get heart palpitations by the end of that. Ignore that one. But it's really up to you. You can make it really interesting by exploring different things. Also, I'd recommend maybe posting to the Facebook group for those who can't or don't feel comfortable joining it. Now, it doesn't have to be Facebook, it could be calling over the phone. It's just a nice way for people to feel connected and not missing out on anything. Perfect. I'm going to keep going here. Yep, okay. I've got lovely Emily in this slide. Yeah, I pulled it. In this final section of the webinar, I'll be speaking to how LCs and walk organisers such as yourself are keeping their walkers engaged during this time. I just saw a quick question come up then. I might just, oh, that's Kate. She looked at Kate. Okay, so last week I actually reached out to one of our fantastic Heart Foundation walking local coordinators to see how she's been keeping engaged with walk organisers, and here are some ideas that she provided. So firstly, staying connected with walk organisers who aren't online. So she suggested getting in touch with walk organisers via phone who don't have an email to ensure that they're kept informed of the situation with regards to Heart Foundation Walking's pause and resume information. So this includes sharing important updates and relevant information that she would have been emailed as a walk organizer, but obviously without a walk email address, it's hard to get transfer that information. 2, looking after mental health while socially isolated. So she's directed walk organisers to some Heart Foundation walking blog articles that we've been releasing during this time, including an article collating some mental health wellness tips that can help you navigate living in isolation during this time. So the following link here has some great tips on staying mentally well at this time if you're interested. She's also directed walk organisers to wider Heart Foundation articles, including providing tips on staying active at home and eating healthy while at home. I found that a bit difficult the first week I was working from home, but we're on a roll now. So I've linked below some articles for your use if you're interested. Now, she's also suggested creating new flyers. So creating new flyers in readiness for when Heart Foundation walking groups resume. This enables groups to hit the pavement walking and ready to promote their walking groups to their local community. So as an LC, you could offer to produce flyers for their distribution, and it could be a fantastic way to help reconnect neighbours, friends, family through physical activity and social interaction. So Heart Foundation Walking has plenty of editable promotional materials ready to go, including flyers, social media banners, and posters for your use. So the resources section of the Heart Foundation Walking website includes loads of different tools that have been developed to help local coordinators such as yourself and walk organisers promote their walking groups and engage with the community. So it's found at this link here. However, you can access it through just the walking website as well. Just follow the prompts. Finally, contacting shopping centres where you have groups walking. So if you're an LC who coordinates a shopping centre group, I would suggest discussing the relaunch date with the walk organisers of the shopping centre groups to see if they're happy to resume. I would also suggest contacting centre management of those shopping centres to advise them of the relaunch date and informing them that our walk organisers and walkers have been provided with COVID-safe instructions and recommendations for when they return to these groups. So letting them know we do have a COVID plan ourselves, but it's always good to just stay in contact and keep those communication channels nice and open. I think, now do I need to do anything here or keep going? Fantastic. Oh, did a little screen graphic, didn't even realize. So yeah, on the left here, here are just some of the examples of the different posters we have available on the resources section. We've got editable flyers, got little social media banners. You can go crazy in your neighbourhood with these. So I also have some ideas for walk organisers. So I've listed some ideas here for all the walk organisers on this webinar of how to keep engaged with your walking group members. Now, you might be doing this already, you might think it's unnecessary, but here are just some ideas. So have you created a group email to maybe reconnect with your internet savvy walkers? It would be a great way to stay socially connected at this time. Do you have any walkers that you're concerned about and may want to reach out to them with a phone call or email? Why not connect with them and let them know you're thinking of them? It may be just what they need at this time. In that case, maybe you could set up a roster system or something similar where people can take it in turns, ringing those who are isolated and not returning back to walking, and I'm sure they would greatly appreciate the contact. Also, did you know you can check for your walkers' details in their online walk organizer dashboard? So these are the details that walkers have listed that they'd be preferred to be contacted on. And any queries you have about this or trouble logging in, please just let us know. And I've listed the link there below of how you access your walking dashboard. Facebook. Facebook is another great platform to stay socially connected with your walking group members. I've definitely been using it a lot during this time. If you're on Facebook, I encourage you to join the Heart Foundation Walking Facebook group to stay connected and informed about program happenings. I'm on there quite a bit, as well as a lot of other program officers. So the group's a great way to connect with other walkers across the country as well online. So you can access the group by following the previous link, or in your Facebook search tab, just search Heart Foundation Walking and it'll be the only group there. So Facebook's even launched a cool new feature. So I'll see if my mouse will show here on the screen, but in the tabs on the right here, you can see About, Discussion, Announcement, Members, Events, Media. There's a new tab actually there recently, which has Rooms on it. So Rooms is a new function where, as a walk organizer or Elsie, you have the ability to go for a virtual walk with members of your own group, or any other Heart Foundation walking group member for that matter that you invite. So the Heart Foundation walking program officers have been running virtual walks most Thursday mornings, but anyone is available to start a new walk for themselves. So if you just follow the prompts of the walk, you can schedule to start at a certain time or start immediately if you're just in the mood to go for a walk and want some others to join. So if you'd like any more information on this, please just let me know in the Q&A function or just a quick email afterwards. You should all have my email address, but you can contact me through the Heart Foundation Walking email address as well. A lot of people have been feeling socially isolated, and the community connection that the Heart Foundation Walking Group offers may be just what some people need. So thank you for bearing with me. I hope this has helped with the transition back to walking groups from Saturday the 20th of June. I now want to open the webinar up to your questions. So please feel free to ask any questions using the Q&A box down the bottom of your screen and pressing enter to send it. So a lot have been answered, I can see in the right here, but I might just address the ones that are currently open. Yeah, so Angela here, Grinnell, has said, sorry, I missed the first 20 minutes of the webinar. Is it recorded? I'm a Victorian LC, so an update on the changes and starting info. Yes, so this is all being recorded, Angela. And I will be emailing the slides as well as the recording to all attendees. It will also be available on the Heart Foundation Walking website. If in doubt, just send us an email at any time as well about information. Oh, I've lost it.
Oh,
it's all good.
Just see if anyone asked a question in the chat, can they? And it wasn't answered.
Okay. So I've just had where there's been some questions in the chat. I'm not actually able to see the chat on my screen, so if you could please answer post it in the Q&A function, then we can answer your questions. The benefit of the Q&A function as well is that all the questions I have saved automatically, so I can see if something needs to be communicated further that quite a few people have been asking about. Okay, so I've got a question here from, I'll start at the top, from Terry. Hi guys, we have found sometimes that the Heart Foundation program is getting weird fingers from what my group has actually walked. I have had one of my team doing 70 walks and she has only done 20. Okay, that's from Terry. So Terry, what I might suggest there is I might have a talk, sounds like it might be an IT issue. So if you could please possibly email us, you can email me at sienna.gamble@heartfoundation.org.au or the Heart Foundation Walking Team. We can look into your specific case. And it may be a case that may be happening for a few groups, but we can figure out the exact IT issue there. And yeah, get back to you about that. I can't say I can answer that off the top of my head without knowing the background on dashboard there. Sorry, Terry, but thank you for asking that question. Okay, from Justin. I accidentally sent my previous question before I had finished. I was going to mention that the issue of having to have a registered walk organizer lead each group in a split scenario, which takes me back to my original question. How do walk organizers manage things if more than 20 people show up and they are the only walk organizer registered for the program? Is it okay for someone not registered as a walk organizer to lead a separate group? The steps are taken thereafter to train and qualify them. So I'm assuming, Justin, that in this circumstance, you have less than 20 people registered for your group, and in the off chance that, say, a few new people show up without registering, what would we...
In terms of the walk organizer?
Yeah. If they could be trained after the walk.
Ideally, we would train them beforehand, but like if you know that you've got a really big group normally, and it's going to be, you know, there'll be 2 groups of 20 or 3 groups of 20, we would suggest trying to find someone that we can train in the lead up to going back to walking, and if it can't be done prior, we might just work with you to figure out alternate arrangements. But perhaps in the meantime, if somebody's a really experienced walker with your group, they might like to fill in, and then we can, yeah, help get them trained up as well if they're interested.
Yeah, the training takes less than an hour as well, and we can walk them through it step by step. But if you do have 20 people in your group, I would recommend just taking a preventative option of just training someone up in case, getting a secondary walk organizer. Even if you have 60 people registered for your group, you know only 10 show up each week, it really doesn't hurt to have that secondary walk organizer, especially if maybe you're sick one week as well. That means that no one in the group can walk. So, well, they can, but just not as a Heart Foundation walking group. So,
but I think if somebody's not trained as well, the most important thing is that if they're doing it and they haven't been trained, we just still need those attendance logs. So if they can keep a track of, you know, who ends up in their group of 20, that would be great for the contact tracing purposes. And then, yeah, we can help you out with training them up in the meantime.
Yeah, so the attendance logs aren't just our requirement, it's the government requirement, so it's pretty crucial. Okay, I hope that answers your question, but you can always...
I'll answer it on the chat as well, so that you've got a record of it.
Yep, perfect. Okay, so I've got a question from Marilyn. Will the Heart Foundation send an email to each registered member giving the started date? So yes, that has been done already, Marilyn. My only suggestion is that maybe if you know, it is a requirement that everyone enters an email for when they sign up to the walking program. However, some people may be sharing an email like husband and wife, or don't have an email, so have just entered something random into the screen there. So if you know that someone in your group doesn't have an email, then either just let us know so we can communicate them, or communicate straight to them. But yes, every Heart Foundation registered member should receive an email giving the starting date. Fantastic. Kate, does the walker... now a question from Karen coming in here. What happens in regards to recording? Is recording in the app sufficient, or do we need to keep a separate list with dates walked? Does the app comply with COVID requirements? As long as it's got the date. Yeah, as app would comply as long as it's just got the date. I do all mine in the app to understand as well. So yeah, as long as it's got the date there, it does comply. Perfect. I've got a question from Susan. I've been having some problems with the Heart Foundation walking out. Just want to be ready in case you spring a challenge when I mostly refer to it. I can't see any challenges coming soon, Susan. We're just trying to get everyone comfortable first with the walking program here. We are running quite a lot of kind of fun challenges. Oh, I take that back. We have got a challenge on our Facebook page at the moment about people taking photos when they're walking. So we're generally using Facebook as the medium at the moment for just fun little challenges, just because the Heart Foundation walking out, there's a lot going on, and yeah, there won't be any kind of formal challenges for a while, so I don't think you have to worry about that. From Denise, has anyone used messages.google.com? Do you recommend it? Can't say I have, Denise. I don't know, you can put that out if any other attendees want to answer that question there, but yeah, sorry, have no experience with messages.google.
Is this for your virtual, like virtual copies and things, or just?
Oh, yes.
Because we really have experience in Facebook and Zoom and Microsoft Teams. They all seem to work quite well for communicating. So
yeah, so if you like any advice around that, I can definitely give advice, but yeah, yet to get onto that platform. Dealing with enough virtual platforms at the moment, I think. Okay, Alice has said, if I want to create a group email for my walk groups members over 120, wow, big walking group. Is it possible to create one under the Heart Foundation domain, or have to create one using my own private email? Fortunately not, it wouldn't be a @Heart Foundation email, Alice, but what I'd suggest is that I have seen in quite a few instances starting just a new email address, full stop, that is just for the walking group. And so that way you won't be getting walking emails and private emails coming at the same time. You could say, I don't know the name of your group, but it could be the Springwood Steppers at gmail.com. And that way you won't be confused, and it could be, yeah, really good kind of means of communication there. Now I'm not sure if you're a walk organizer or LC as well, but yeah, you could always kind of send the little tips I talked about previously through that email address. So yeah, it doesn't have to be your own private email, but also not the Heart Foundation domain, something in the middle that references the Heart Foundation that you can also access. Okay, so if a new walker arrives for a walk but is not registered, are they allowed to walk on the day? I know previous advice was that they just have, there's an acknowledgement that is contained with actually in the pen that all walk organisers would have received that they need to read before they walk. So that's the walker acknowledgement, but I might check in with my colleagues here about if someone isn't registered.
Yeah, so
a new walker arrives for a day, perhaps not knowing any Heart Foundation walking practices. Previously, they could just read the walker acknowledgement and then walk with them on the day.
Yeah, so
that suffice?
Yeah, so long as we can show them the sort of terms and conditions or the acknowledgement prior to walking and take all of their details and just refer them to the walker T's and C's. We really need to make sure that they've read those before they join our group. So if you can have those handy, then they're very welcome to join. Otherwise, would suggest taking their details and then letting them know when the next walk will be is the safest option. But if they're super keen to join, then yeah, showing them the acknowledgement or directing them to the T's and C's and asking them to register that same day would be great.
Perfect. Yeah, so all our walker T's and C's are on the website. They're quite clearly labelled, but if you'd like me to send them through, you can. Fantastic. Now I have two questions here about the the dates being on the attendance log. Actually thinking about it now, I guess it is just the manual attendance log that has the individual dates. Now I will check in to see if there's a solution we can offer for you in terms of electronically. But what I was referring to here was when you log on to Heart Foundation, you can print the attendance sheet and there you can tick off individual days, or you could just keep a tally perhaps in your notes. I'm hesitant to say that. Yes, let me get back to you, Karen, as well as the anonymous attendee who's asked the question about the individual dates recorded on the app or electronically.
Yeah.
From a digital IT point of view, I'm not sure at this point.
If we can't change it, and we will have a look to see whether we can, just important for your own purposes that you keep a manual note of who was there on what day. So as long as you've got that somewhere, ideally it's within the app, but if we can't get that amended, just keep a manual note of the date and your attendees as well would be great.
Perfect. Now I just want to double check. I see there's quite a lot of chat going on. Has everyone that's asked anything in the chat transferred the question to the question and answer? I'll just wait a minute or so to make sure that's all gone through. Okay. So I've got a question from Leanne here that says, could the attendance list be amended to allow walkers to put mobile number on list to enable contact tracing? Now, the mobile numbers for each walker should be available to you as a walk organizer through the dashboard. If they wanted it to be on there, depends on their preferences. But in terms of amending the list, we can see, but because it is available in the dashboard, I can't really see the need for it on the actual physical attendance list. If you'd like advice on how to find it within the dashboard, please just contact us and I can talk you through the whole process. Give me a ring. It is okay. So that hopefully answered your question there, Leanne, that you can access the mobile numbers. Oh, okay. It is a requirement in Vic to have mobile numbers for contact tracing. So yeah, so you do have the mobile numbers and we have the mobile numbers. It just isn't on the actual attendance list itself, like the physical list. But they are on dashboard. They do have the walks recorded next to them. Like everything is on the system, just in two different places. So yes, it would cover that requirement in Victoria. So I've got a question from Keith here. I have over 50 registered walkers now, but less than 10 actually walk. Most have never walked despite follow-up from the emails. Oh, I feel that pain, Keith. Can we cull non-attendees as the list is very will-do now? Yes, what, I might check in just the time frame that they've never showed up. So if it's been like a few months and you've reached out and they're not coming to a walk, maybe let us know, and then we can cull non-attendees, because we do go through quarterly or biannually and go through and remove people that maybe have registered and have no intention of joining a group. But if you've noticed that in your own group, Keith, then please just let us know and we can hope to clear that a bit for you. Or maybe even get a few new walkers along to your group. It has been 12 months or more for most. Oh, Yeah, no worries. We can help you out there, Keith. Just maybe if you just pop in an email to us, or just let us know the exact walking group that your walk organizer for, and we can go through and address that for you. Okay. Thanks. I know it's on dashboard. Perfect. Oh yeah, perfect. Thank you, Leanne. Over 3 months, you can delete walkers from your list. Yes, exactly. So we go through and go through every 3 months or so, but we might have missed a few in our reporting there. Is there anyone else with any questions?
Was there anybody that asked questions in the chat function, but not the Q&A, that hasn't had their questions answered? If so, would you mind just asking them in the Q&A function and we'll answer them right now?
Yeah, okay, through here. Perfect. Well, is that something coming through? Just want to change that. Okay, so question from Marilyn. My group is wanting to change the name of our group to something a bit more up to date. I feel like a bit catchy. How simple is this to do it? Very simple. Just log into your online dashboard and you can change it yourself, Marilyn. If you want to give us a quick call or email to have specific instructions, we can do that. But as a walk organizer, you have full autonomy to change the name of your group to something a bit more simple. Please let me know how to edit a phone number for a member of my group. That's come in from Janet. Janet, I'm not sure if you can change. Can you change the phone number as a walk organizer? I'm not sure. As a local coordinator, you can. However, as a walk organizer, I'm not sure if you'd be able to edit a phone number for someone else. I would suggest that they change it, or you suggest they change it themselves, or as members of the Heart Foundation walking team, we can change it with administrative access to the website. So if they contact us, we can change the phone number for members in the group. I've done that plenty of times. It's a very quick process.
Have a look at Leanne's question about the mobile number.
Sure. So, yep. And then I've got one more from Catherine here that's saying, can we copy and paste to our Facebook the rules of our group from the PowerPoint? Yeah, go ahead, go for it. Yeah, it'd be exciting to see new members join our Facebook group, as well as your own little groups, not little, own very special groups. Fantastic. All right, well, I might wrap it up here. Just we've gone quite a bit over time, so if you just want to send emails if you have any more questions, or if I didn't answer something to your specifications, please just let me know. But we've had quite a few come in, over, what was it, 60 questions come in during that time. Thank you so much, Kristen and Emily, for helping me go through them and answering them. Yeah, as you want any more information or access to Heart Foundation resources, please give us an email either to the walking address or my address that you would have received with the webinar invitation, or call the Heart Foundation helpline on 13 11 12. As I said, this has all been recorded and will be available to view soon on the walking website, and I'll send a link out in a follow-up email. It'll probably be in around 3 days. We'll see how fast I can kind of clip and edit everything together. But yeah, once again, thank you so much for joining me. Hope you enjoy the rest of your day and try and get out there and keep active, even during this time, walking during COVID-19. Perfect. Well, thank you everyone for joining, and I will stop this webinar now.